Good morning to everybody on the behalf of L.N.Ayurvedic.P.G.entrance coaching center, Salminagar, Hyderabad. Today's topic: Dishlikata rogas and their doshadikata and their sadhya sadhyata. See, you take pitta vedagya drushti. The adhikata of the bhuta will be, dosha will be pitta, and it is a sadhya asadhya in the sense it is sadhya roga. What is the main principle regarding chikitsa in the sense? It is ashastra krita vyadi. It is a ashastra krita vyadi. Pittaja vidagda, doshadikita pitta, and the line of treatment, if you are coming in the sense, it is ashastra krita vyadi. Next you are coming to kafaja vidagda drushti. Kafaja vidagda drushti. The disease name itself indicates it's the nature of dosha, kapha. It is a sadhyatva. In clinical point of view, it is very, very important. Kafaja vidagya drushti is nothing but night blindness. Kafaja vidagya drushti is nothing but night blindness, and it is also ashastra krita. Now we are coming to Dhomadarshi. So smoky vision. Dhomadarshi means what? Smoky vision. Pittajikata will be there. Sadhyatva. Sadhyatva means it is sadhyatva. In Dhomadarshi, what is the line of treatment in the sense? Pittaja abhishena chikitsa, pittaja abhishena chikitsa has to be followed. Pittaja abhishena chikitsa has to be followed. Now we are coming to Hrasvajajya, rhinitis pigmentosa. What is Hrasvajajya? Hrasvajajya means rhinitis pigmentosa. Pittajikata will be there, and it is asadhya vyadi. Pittajikata will be there, and it is asadhya vyadi. Now we are coming to Nakulandhya. Nakulandhya. What is Nakulandhya? It is a type of night blindness. Nakulandhya is nothing but a type of night blindness. Both tridoshas, vata, pitta, kapha will be involved here, involving in the sense, and it is asadhya vyadi. And it is asadhya vyadi. Gambhirika, thysis bulbi, Vatajikata will be there, and line of, see, it is an asadhya vyadi. It is an asadhya vyadi. Now we are coming to the subjective symptoms. In Pitta Vidagda Drushti, visualization of the things in yellow color will be there. In Pitta Vidagda Drushti, visualization of the things in yellow color will be there. And Kapha Vidagda Drushti, person feels that the things are in white in color, visualization in white in color. And in Kapha Vidagda Drushti, if the doshas enter the third patala, then it leads to night blindness. Third patala leads to night blindness. Because Nakalandhya, what is the main important character, sign? The objects are seen in multicolors and cannot see in nights. In case of Nakalandhya, generally the objects are seen in multicolor and cannot see in the sense the person will lose the vision in night hours. Okay, now we are coming to Bhedya Netra Rogas. Now we are coming to Bhedya Netra Rogas. Sanimitaja Linganasha, and it is asadhya. Animitaja Linganasa, asadhya. See what happens in case of Sanimitaja Linganasha. Generally, Tapa, Sirasula will be there. Tapa and Shirasula will be there. Now we are coming to Anumita Jalinganasya. What happens in case of Sanimita Jalinganasya? Structural deformities chances are there. Whereas in case of Anumita Jalinganasya, structural deformity will not be there. Structural deformity will not be there. Okay, next you are going to Lekana Sadhya Rogas. Lekana Sadhya Rogas are totally, they are 9 in number. Lekana Sadhya Rogas are 9 in number. Uchangini, Kumbhika, Potaki, Vartma, Sharkara, Bhagala Vartman, Banda, Krishna Vartma, Kardama Vartma and Shava Vartma. Kardama Vartma and Shava Vartma. Once again, I am reading in examination point of view, this type of presentation is very, very good. See, remembering the things is not so easy. It requires practice. Bhava Abhyasanam Abhyasaka Siranam Satatakriya. Practice makes a man perfect. See, in examination, what happens? People will think that we can answer in a predicting manner, or we can answer whatever 4 gives, one will be correct, so one we will tick like that. Not like that. See, basically you are supposed to have the fundamental points. So that is why good practice is required. Generally, people will think and spare much time on reviewing the old papers also. Even to go for the old papers, you are supposed to go through the fundamental old books. You review it first. If you are able to review the subject, definitely review the subject. Within 2 days, see what is the measure of studying in the sense, you are supposed to cover the things in short span. See, initial level, 4 days, 3 days. See, when the exams are nearing, within 1 day you are cover the subject within 1 day. So that time you are supposed to speed up the time, and you have to make your brain very sharp to remember and to recollect the things easily. So now I have told the Lekana Sadhya Rogas. In Lekana Sadhya Rogas, anyone may be asked, one of the following is Lekana Sadhya Roga, or one of the following is a Lekana Sadhya Roga. The question may come like that. Bidalaka. See, what is Bidalaka here? It is nothing but a Vartmalepa. This Bidalaka is nothing but a Vartmalepa. Application of medicated paste to the eyelids except at the eyelashes. So, what is Bidalaka? Application of the medicated paste to the eyelids. So now, different types are there in this case. Uttama Matra, Madhyama Matra and Hina Matra. What is Uttama Matra, Madhyama Matra, Hina Matra? We will come to know. What is Uttama, Hina and Madhyama? See, 1 inch thickness is Uttama Matra, 1/3 thickness Madhyama Matra, 1/4 thickness Hina Matra. Now I will tell you some of the important Bidalaka yogas. Haritaki, Sunti, Tejapatra and Kapha Vyadis. Haritaki, Sunti and Tejapatra and Kapha Vyadis. Vacha Haridra, Nimbapatra in Kafaja Abhishyenda, Sulti and Gairaka in Kafaja Abhishyenda, Sulti and Gairaka in Kapha Abhishyanda. So these are the some of the important yogas in case of Bidalaka. In case of Bidalaka. Now Pindi or Kavalika or Pindika. What is the Pindi? The selected dravya in a kalka form kept in a fresh and thin cloth and applied on the ice. On the ice it is applied. In case of Vataja Netra Rogas, Snigdha and Ushnagunahita Dravyas are used. In Vataja Netra Rogas, Snigdha and Ushnagunahita Dravyas are used. In Pitaja Netra Rogas, Shitala Dravyas have to be used. In Kapaja Rogas, Roksha and Ushnagunahita Dravyasa, Roksha and Ushnagunahita Dravyas are used. Now, Pindi with Triphala is applicable in case of Abhishyenda. Pindi with Triphala applicable in case of Abhishyenda. So here what is happening? It is a very popular by name Kavalika or Pindika. Kavalika or Pindika or Pindi. Pindi, Pindika or Kavalika. Selecting the dravya, making kalka, keeping cloth and applying on the ice is Pindika. Right. Pindi is done with Amalaki or Mahanimba Patra in Pitta Vishyanta. Amalaki or Mahanimba Patra in Pitta Vishyanta. In case of Vata Vishyanta, what are the dravyas for Pindika Yoga in the sense? Erana Patra and Erana Mula are used. Erana Patra and Erana Patra and Erana Mula are used. Erana Patra or Erana Mula are used. I think in the last classes regarding the Kriya Kalpa topics, we have covered Anjana, Astyodhana, Tarpana, Putapaka, all the things we have mentioned. Right. Charaka mentioned, note the in examination point of very, very important here. Charaka mentioned three Kriya Kalpas. Bidalaka, Astyotana, Anjana. Bidalaka, Astyotana and Anjana. Susruta mentioned 5. Seka, Astyotana, Anjana, Seka, Astyotana, Anjana, Tarpana and Putapaka. Seka, Astyotana, Anjana, Tarpana and Putapaka. Sharangadara mentioned 7. Seka, Astyotana, Seka, Astyotana, Pindi, Tarpana, Vidalaka, Putapaka, Anjana. Seka, Astyotana, Pindi, Tarpana, Vidalaka, Putapaka and Anjana. See, generally these are the important fundamental points. Again, so many yogas will be there. Sometimes generally in examination point of view, the examiners will give importance to the number, their types. Later on, if they are interested, then they go for examples. Regarding examples, what is an example? Example is nothing but a yoga. It is not. So many yogas will be there. They may touch, may not. But generally, they will touch the number and the different types. Most important, they will touch the number and different types. Now let us see classification of anjanas, important aspect. Classification of anjanas according to rasas. Madhuranjana, Amlanjana, Lavananjana, Katuanjana, Tiktanjana and Kashayanjana. Madhuranjana, Amlanjana, Lavananjana, Katuanjana, Tiktanjana and Kashayanjana. See, generally, if you are using the dravya, you should know in which type of patra you are supposed to keep. If you are using Tektaras dravyas, you are supposed to keep in Kamsya patra. If you are using Tektaras dravyas, you are supposed to keep in Kamsya patra. Kataras dravyas, if you are using, keep in Vaidurya patra. And Kashaya dravyas, if you are using, you can keep in Tamra patra or Loha patra. Tamra patra or Loha patra. Now, if you are coming to Lavana, Rasayita dravyas, you can keep in Meshasringa patra. Meshasringa patra. Amla dravyas, if you are using, Raupya patra using. If you are using Amla dravyas, you can use Raupya patra. Now we are coming to the Madhura dravyas are using. Suppose if you are using Madhura dravyas, you are supposed to keep in Swarna patra. Madhura dravyas, you are supposed to keep in Swarna patra. See, based on the nature of the shape of a dravya, different types are there. Gutika is there, Rasakriya is there, Churna is there. If you are using Gutika or Varti, generally extremely pathological conditions you can use it. Rasakriya you can use in case of Madhyama Bala Rogas. Churna is used in case of if the Roga is in Alpayuta. Now we are coming to the next bit. Gutika, Lekana Gutika, Ropana Gutika, Prasadana Gutika. Lekana Gutika types Lekana Gutika, Ropana Gutika and Prasadana Gutika. Now you are coming to the Rasakriya. Lekana Rasakriya, Ropana Rasakriya and Prasadana Rasakriya. Lekana Rasakriya, Ropana Rasakriya, Prasadana Rasakriya. Now we are coming to Matra in case of Gutika. Uttam one Harena Matra in Lekana Gutika, Ardha Harena Matra in Ropana Gutika, Ardha Harena Matra in Ropana Gutika, and 2 Harena Matra in case of Prasadana Gutika. Now we are coming to Rasakriya. What is the Matra or dose in case of Rasakriya? 1 Harena Matra in Lekana Rasakriya, Ardha Hareno in Ropana Rasakriya, 2 Hareno in Prasadana Rasakriya. Suppose if you are using Churnas, because of Lekana Churna, 2 Shalakas, Ropana, 3 Shalakas, and Prasadana Churna if you are using 4 Shalak. Now classification of Anjana according to karma or potency of the drug. Murdu Anjana and Tishna Anjana. Murdu Anjana, Tishna Anjana. In Murdu Anjana, Snehana Anjana, Ropana Anjana, Prasadana Anjana will be there. Snehana Anjana, Ropana Anjana, Prasadana Anjana will be there. And in case of Tishna Anjana, Lekana Anjana comes. In today's class, some of the important bits you came to know, and in case of any need, just contact or go through well. You have to spare minimum half an hour to keep these bits in your brain. Study well. Let us meet in the next class. Thank you.